form of facial covering, have that social distance, we can prevent it from happening here. And we're acting faster than some of our companion states. These are two that I talk to regularly. Ohio and Indiana have now followed our and other people's lead in requiring facial coverings. This should tell you that the step that we took is the right step, given what we're seeing, but also this is going to help. The fact that two neighboring states are also doing it should make Kentucky's response more effective. These are two governors that I respect. I'm glad they took this step. We had talked about it on different occasions. They obviously deal with different constituencies than I do with their states and the differences. But this now region, Ohio region requiring facial covering should help all of us, and it should show you that there's no political division in what is the right public health response. Between myself and these two governors, you have two Republicans and a Democrat, and we all agree that one of the most important things we can do right now to stop COVID is for people to wear a facial covering. This isn't a Democrat or Republican thing. This isn't a political thing. This is a public health tool that is the difference between life and death. This is going to be the number one thing to determine if we can keep our economy open, and this will be the best tool to try to get our kids back into school. Let's make sure that we do it. Because as we see in today's numbers, we are still at an elevated rate. They are thankfully a little bit lower than yesterday's, but still show an increase as you look back, especially 2 weeks ago. Today we're reporting 518, that's 518 new cases of COVID-19. That brings our total number of cases to date after we remove duplicates to 24,540. So again, when we think about 518 cases and we remember the mortality rate that we deal with here in Kentucky, even being better than most of the country, that's a high number. That means we're going to lose a lot of people. So going forward, let's do what it takes to cut down on these cases, to get to a new plateau and then to a new decrease. Today's 518 positive cases come out of 10,953 total tests. That brings our total number of tests administered to 560,161. Now, because of the way the reporting works, positives coming in differently, we can't say that these 518 positives were tests taken on the same day as all the other negatives. And that's a data issue that every state deals with. But what we do is our very best in when we get the data to give as much accurate information as possible. Our positivity rate, 7-day average, and those are based on our actual numbers where we're able to use direct numbers that come in from us. Our positivity rate's gone up. It's now at 4.92%. That is a concern, and it shows it's not just an increase in testing. It's more people that are being tested are showing positive results, which is what we know. We're seeing more cases all across America. We know the coronavirus is increasing. We know that it's spreading, and that's why we're going to do what it takes to defeat it. Today, our total number of individuals, total number of Kentuckians that are hospitalized because of the coronavirus is 603. That's up from yesterday. Our total number of patients in the ICU, Kentuckians in the ICU, is 145. Again, that's up, I believe, from yesterday. Our total number of patients have recovered, 7,000. Again, that number is as accurate as we can get it, but those are only reports that we get back in. I believe the number of recovered is actually larger, maybe even much larger than that. But as you're seeing through the news, not everybody's experience in recovery is the same. Some may recover fairly quickly. Some who are asymptomatic will test negative later on. Some are still dealing with the residuals of this even months later. So it's a nasty virus. And even if it's affecting somebody that the statistics say it probably won't kill, it can really harm them, and we still don't know moving forward what type of long-term effects it'll have. So let's try to make sure that fewer people get it and that we don't spread it. to other people. New cases by county. Jefferson 83, Warren 49, Fayette 34, Kenton 24, Boone 22, Barron 20, Scott 19, Hardin 15, Campbell 12, Laurel 11, Perry County 11, Bullock County 10, Franklin County 10, and everybody else is in the single digits. But again, the numbers in these different counties can add up quickly, especially because we see it now spreading really in clusters. I did see a report the other day that they believe that an asymptomatic person spreads this virus to at least 2 to 3 other individuals. So you see how quickly that it can spread. All right, today we have 13 kids under 5 that have tested positive. We are tracking this because the percentage of the total tests for kids in this age group are going up. Now, it could be that we weren't testing that many kids in this age group before, but this is still really important data that we need to know. They're in 7 different counties. Youngest one, there are 2 that are just 5 months on this list. We certainly hope for the type of outcome that we've seen in most others of this age, and that is a recovery and hopefully very few symptoms, being a dad with kids that have gone through much less. That's what I would want for absolutely everybody. Today we're reporting 3 new deaths to COVID-19. A 49-year-old woman from Simpson County. I know that there are some underlying health conditions in this one, but 49 ought to hit people pretty hard. A 69-year-old woman from Allen County. Again, we are seeing a lot more people in their 60s recently passing away from this virus. And an 81-year-old man from Webster County. So I believe there's at least a couple of new counties there that are experiencing loss. Let's remember those green lights. Let's remember those bells at 10 a.m. We're gonna be at this a while longer, and there's going to be more loss out there. And I think that the people, the families that lose their loved ones 4 months into our fight against this virus deserve our support as much as those that we lost earlier. Our total number of deaths is now 677. Sadly, I think we need to expect that we will see in the coming weeks a significant increase in that. More cases times the mortality rate, even if we can push it down some, is going to equal more deaths. And what we see is an increase in cases before you see the spikes in deaths. So we know that this is a life and death issue. The fewer people we can get infected, the fewer people that we will lose. So let's keep up that fight. Ethnicity breakdown is about the same as we've seen just of total cases. Again, a little over 15% of cases in our Hispanic population. And then when we separately look at race, 78% white, 12.43% black or African American, 5.87% multiracial, about 3% Asian. And then when we go to our deaths, and we'll post all this online, the death rate on Hispanic individuals is about the same percentage they make up, that group makes up of the population. Whereas, again, when you look at race, our black and African American population almost twice. Thankfully now a little less than twice. For a while it was a little more of percentage in deaths as compared to population. Long-term care. We continue to see some new cases in long-term care, though from the rate we were seeing earlier. We do think that this is stabilizing, but this is, as long as we have COVID-19, this is going to be a fight. And it's a fight to protect those that are most vulnerable. 31 new residents have tested positive, 2 new staff, and 2 new deaths. And remember, these aren't new numbers from what we report in the given days. It's that we go back and determine from those numbers how many of the positives were residents here or how many were staff. But look at that staff number. I mean, that shows you that this virus is significantly impacting staff in our long-term care facilities. And guess what? They show up anyways to help the individuals in those facilities. That's heroic. It also says that we need to make sure that we have a good testing program for them, which we are implementing now, to make sure that they know if they are positive so that they don't take it into a facility. And given that amazing work that they do, we can make sure that they stay healthy, and if they need help, we can give them help. Because let's remember, we've lost 3 staff members to this virus. We don't want to lose anybody else to this virus, but it certainly hurts when it's someone that shows up to help someone probably already and knowingly suffering from COVID-19. Unfortunately, we have some increases in our Kentucky child care facilities. We have 6 new facilities, bringing it up to 36 child care facilities that we know of that have at least 1 case associated with COVID-19. It doesn't mean that they are a cluster, but this is the way we report our long-term care facilities. So it's 5 extra staff and 3 additional children. But there's good news out there. Everything that we give on the report right now, because we're still waiting for the steps we've taken to have their impact, knowing that when you take a step, it's going to take 10 to 14 to 16 days to show up in the numbers. There are good signs out there. So I want to start with today's social media, and the first one is a pretty special one. After being hospitalized for 116 days in a Louisville hospital, Rhonda King, who's 56, has gone home after recovering from COVID-19. Rhonda was admitted to the hospital on March 27th and was put on a ventilator in a medically induced coma. Despite this, her husband called 3 times a day so she could hear his voice and he could remind her of her strength. Rhonda began to improve after receiving a plasma donation from a COVID-19 survivor. And there are multiple heroes in this real-life story. After 3 months in the ICU, 3 months, Rhonda entered rehab at Baptist Health. Yesterday, she went home. Rhonda thanked those at the hospital who cared for her. Her husband, Anthony, who she met 41 years ago, that'll be 1978, said those in the hospital were God sent. Rhonda is now looking forward to spending time with family, including her 4 grandchildren. This is a story of triumph. It's a story of compassion, of faith. I hope it reminds people of the seriousness, but also celebrates those that are fighting this battle and those that are helping them. And just, if you unpack what happened here, you've got our frontline heroes in the hospital and the rehab center. You got whichever individual donated the plasma there. You've got her husband calling every single day, not knowing whether she can even hear his voice. And then you got her putting up that fight that it took to defeat this virus. Those are special stories. And we don't want anybody on a ventilator for 3 months, but we want more positive stories of someone ultimately has to go through that. All right, this next one is just about everything we're asking for. This is a couple on a staycation, meaning they have not traveled to any of those states that we are concerned about because of the high positivity rate. They're also wearing masks in their picture. This is, I'm not kidding you, this is how we beat COVID-19, and it should tell you that while it is an inconvenience, it doesn't have to be that hard. They are on a form of vacation. That's Frankfurt in the background. They're on a form of vacation. They're finding some joy in what they're doing, and they're following the rules to where we can beat COVID-19. I love this next one, because it shows, again, our kids don't get down. They do what it takes. This is a kiddo who is at a doctor's appointment, doing what it takes to stay safe in that environment. And let me say, if you've been putting off doctor's appointments, please don't. We believe that it's safe now. The facilities have so many different safeguards in place, and we want to make sure any other health conditions don't get out of hand. So make sure that you go see your doctors. Make sure that you get the care that you need. We don't want COVID to result in losing you to something else or your health deteriorating. I would tell you if I didn't think it was safe. It is. Please make sure that you go get those checkups. All right. I love this next one too. This is a 100th birthday at Cedar Creek Presbyterian Homes. And this is for Geraldine Branham. This was Monday, July 20th. This is in the midst of COVID, doing it right, celebrating a 100th birthday. So I say every day different reasons that I wear a mask. Today, I wear a mask for Geraldine, making sure that COVID will be over by her 101st birthday. I believe that, and I can't wait for her to have an even better one then. And I'm just going to assume that chain is the social distancing line to make sure that everybody stays that 6 feet away. Next one's a little personal to me. So some of you might know that I hold a distinction I'm pretty proud of. I'm the first Kentucky Governor Scholar to ever serve as Kentucky's governor. It's a program that changed my life. I wouldn't be here. I don't think I'd be comfortable in my own skin without this program. It made a long-lasting impact on me. And COVID has made it really challenging, knowing that these programs are out there and what will happen. I got to tell you, this program, I think, can serve as a model in how we try to get back to a new normal. These young leaders, because they are all young leaders, have adjusted. I've now had a Zoom call with every single GSP class, which is much smaller, and they go back into their communities and serve as an amazing role model, not just to young people, but to all people, about what we need to do to fight this virus while also making those connections that, listen, I still have today. One of the top officials in my governor's, my attorney general's office, Gretchen, who did such an amazing job, was actually one of my RAs when I was at Governor Scholar. So she remembered that, and then she reminded me. Last one. It's what you see every single night in Frankfort. And this is what I see every night before I go to sleep and every morning when I wake up, because I haven't gotten up after sunrise in a long time. This is our Capitol lit up green in compassion. It is a reminder of our battle, but it is also a reminder that we're going to get through it, and we're going to get through it together. I'm going to ask Dr. Stack to comment on where we are now, and then I'm going to give some budget news. And our budget news has a surprisingly good piece in it, and then it still has the very grim prediction for what is coming. But I'm excited to give a little good news today once we hear from Dr. Stack on our need to continue to wear these and do what it takes.
Thank you, Governor. Good afternoon, everyone. I am going to remind people what we need to do, but the governor also gave me the opportunity before to share some thoughts about some of the other items that I thought might be important. So I have a grab bag of items to update you on tonight. So people ask about drugs and therapeutics. So remdesivir is still one of the few drugs that has been felt to potentially be helpful. It's still an experimental treatment. The federal government had secured a donation from Gilead, and we have been distributing that out upon physician request in Kentucky. It's now shifting to a purchase approach, which requires a fair amount of logistics and complexity. It's difficult to convey just how much has been asked of state and federal government and local government, but I'm thinking about the state level because that's where I reside right now, trying to figure out innovative ways to get these things accomplished in short timelines. I want to thank, though, whenever I can, the partners we work with. And in this case, I want to thank the many hospitals and the Kentucky Hospital Association, because they are working with us on a model so we can ensure we get 100% of the drug that the federal government has allocated to us into the state, so we don't leave anything unused in trying to help Kentuckians who need the treatment. So thank you to the KHA for their help and their partnership. We can't get these things done without these public-private partnerships, and there have been many of them. On data, it's imperfect, it will stay imperfect, it will forever be imperfect. I and we commit to give you the best data we possibly can. We've had a lot of questions lately, we always do, but about how the 7-day positivity rate for testing varies. My response on all of these is we'll continue to be accountable and transparent and share how we calculate things, but I and the department I oversee at the Kentucky Department for Public Health are the repository for the official data on COVID-19 for the state of Kentucky, and I don't know how all the other sites calculate their numbers or why they vary. The official numbers come from the state of Kentucky about Kentucky. For deaths, I want to share a thought. There's been comments over time about an extreme example. If you're in a car accident, you have COVID, are we going to say you're a COVID death? The answer is no. Your death will be categorized as an automobile accident. We have a committee that looks at death certificates that are questionable as far as the cause of death, and they've decided today to remove a number of COVID cases that were listed on their death certificates as COVID related, and in their review of the information have determined that those deaths are not appropriately coded as COVID. So this is an instance where it ties into the data when the CDC will report a higher number than us because they'll get an official death certificate, but our committee, closer to the data, has made an informed decision that we are not going to include these deaths, this small number of deaths, as COVID related. We're committed to being honest and open and trying to be as credible as possible so that if we say it is COVID related, we believe coronavirus contributed to that person's demise. Hospitals, people ask and share concern about, at times, are we trying to make this sound more alarmist than it is? Well, these states around us that are struggling more and earlier and have a higher and steeper climb on their curve, so Georgia and Tennessee, and of course Texas and others, I had report from at least one hospital that their partner hospitals, the chain they're part of, that they are pretty much full in Nashville, Chattanooga, and multiple places in Georgia. And in fact, we have apparently in at least one hospital received transfers from those other states into the state of Kentucky to help their sister hospitals in other states that are suffering more. It's real. We're committed to helping fellow Americans, but we got to keep capacity for Kentuckians too. It's going to be difficult, and so your actions are going to make the difference for how bad this gets. And the last two things, testing. We have worked heroically to increase testing. We don't have enough still. Not everybody can always get it as quickly as they want, but the governor either has announced or will announce here shortly over 10,000 more new tests today. We have come light years from where we were a couple months ago. I want to emphasize for everyone listening, though, we cannot test our way out of poor decision making. We can't test our way out of bad judgment. You don't solve an infection with a test. You prevent an infection with a mask and with social distancing. So as much as we will continue to work very hard, and the governor's made it very clear it's on my top list of things to do, to expand testing as quickly and as much as I can in partnership with the rest of government and the others with whom we partner with. If people don't take steps to self-isolate, to wear masks, to socially distance, we will not be able to keep up with testing, and we'll run out of materials nationally and in the state before we ever meet the need. Please do the interventions we ask you to, because that's how we don't run out. And then the governor mentioned this, but I want to emphasize it. If you feel you need medical care, get medical care. Go to your doctor. Go to your primary care office, get medical care. They're there, they're ready for you. We know that there are other needs that when we asked people to stay at home, you hunkered down and we kept the curve flat. You have to take care of your other medical needs. And I'll emphasize at least one or two right now. One, if you have a child who's vaccination age, get your child into the pediatrician, please, to get your vaccines. We don't want to have children have consequences from preventable illness because they didn't get their vaccines. Please make sure you get your children in for their vaccines. And the second thing is, if you think you have a medical or surgical emergency, if you think you have a stroke or a heart attack or appendicitis, do not hesitate. Go to the emergency department if you feel you have an emergency, or communicate with your doctor directly and seek their guidance. You need to be able to go get care. The hospitals are much better prepared now. They know a lot more about how to keep people safe. They have better supplies of equipment. Please do not delay getting care if you need it. We can control this. Our curve is going up. It's going up steeper than we would like. The governor's announcing much bigger numbers than we had hoped over the last week or two. But let me tell you, whether that turns into a little hill, relatively speaking, or a big mountain is entirely dependent on the actions of Team Kentucky. We can blunt this curve just like we flattened the first one. It's not too late, and hopefully the steps we've taken since July 5th have helped that, and we will see next week if that's the case. But we're in this for the long run, and I'll tell you, we're all tired too. This is not easy on anyone, but we're committed to working with everyone in Kentucky to keep as many as we possibly can safe. And I thank you for all you've done, because it's made a difference. And if you have any doubt about that, there's plenty of publicly available data sites that show that Team Kentucky, this is one time we were really at the top of the pack for public health, and we've done good together. So thank you, and thank you, Governor.
As we know, the coronavirus has impacted just about every area of our lives, of our businesses, and also of our budgets. But today I've got a little piece of good news, and then we still have a major concern going forward. You may remember that the Consensus Forecasting Group, we called in, we had them look at the current fiscal year that we are in. And I believe that was on May 22nd, they projected a $457 million shortfall. Well, since that day, our executive branch cabinets have been working very hard to cut expenses. And I'm pleased that we have had significantly higher revenues come in, and we believe even more will come in by the end of this week when we close the books at the beginning of next week. The deadline to file taxes was about a week ago. That deadline was moved from April 15th to July 15th because of the pandemic, and so now we have a much clearer view of where we stand. Now, this is preliminary. We don't have all the numbers in, but when the books close once and for all next week, I actually believe that I will end the first fiscal year that I've been governor without a shortfall whatsoever. To date, with some collection tax payments still to be counted for the rest of this year, general fund collections are at a total of $11.46 billion. As of today, and we have much more coming in, we're just a little $4 million in the red, and we expect, in fact, to be outside of that. So here's what I expect from the end of this fiscal year. No budget cuts to K-12 education, post-secondary education, health, and public safety. There had been some dollars that we had asked for our public institutions, our colleges and universities to hold back. They're going to get those funds, and I'm very excited about that. No cuts to the judicial or the legislative branch. So let me repeat that. It means no cuts to education, health, public safety, or the judicial or legislative branch in the budget that we just ended. We would have been paying for that going forward. We also expect to increase our rainy day fund, the Budget Reserve Trust Fund, by over 18%. And one last bit of good news is, due to higher lottery revenues, need-based student financial aid will receive another $15 million above what we expected for the year to come. Now, I know there's people out there thinking about taking a gap year, about not necessarily moving forward with their education in the midst of this pandemic. We need more of you to get that higher education, to get that skilled trade. We need more four-year college graduates here in Kentucky. We need more people with a skill and a trade out there. I would highly encourage you to make sure you are taking advantage of these programs with historic amounts of aid out there. Right now, we can be making the investment in you that will pay off for our Commonwealth and for you and your family or your future family. I believe I saw the other day some statistics where during this pandemic, people without a college degree have lost their jobs at 2 times the rate as those with one. And so making sure we get a more educated and skilled population is one way that we also become stronger in that if we ever see a pandemic like this again, we will not be hit as hard as we have been hit. So I want to thank our state agencies. I asked a lot of them. I know when my dad was governor, I think he was asking them to cut their budgets just about every month. But in my first fiscal year as governor, I asked them to reduce their spending by 1% in the last 2 months, just in the last 2 months. And they did better than that. We'll have the official numbers, but they did better than that. They held back on hirings. They cut back on discretionary expenses. They stepped up and went above and beyond, and that was necessary to get where we are today. So a little good budgetary news. As you remember, our road fund also came in better. It doesn't look like we're going to have any budget reduction in that last year's road plan. And for the first time in 2 months, we actually did what's called a letting, accepting bids to do road work. And while that's good, that's from the last fiscal year. This current fiscal year that we are facing does look to be as dire or likely as dire as what we believed it would be. Our fourth quarter general revenues, April through June, have declined by almost 8%. That's the worst fiscal quarter since the Great Recession. Road fund revenues, April through June, also declined. So looking ahead, while we will need a new estimate, the last estimate that we have is almost a $1.1 billion shortfall in the year to come. Without federal assistance in either a new CARES Act, providing direct budgetary assistance just like they did during the Great Recession, or Congress changing one of the last CARES Act and giving us more flexibility to use past funds given to us directly in our budget, we will be looking at, I believe, the largest budget cuts in our history. Now, I hope that what happened in this last fiscal year has a chance of happening going forward, but we know what we face moving forward without federal assistance is really rough. And who pays when that happens? Well, the vast majority of our budget is our health care, our education, and our corrections costs. And the corrections costs are really hard to impact in any given year. So who pays when we don't have the funds we need? It's those that need us the most. And at a time when we're trying to get our kids back in school and at a time when we need to be healthier than ever, it's not the time to have cuts in those areas. And I'm going to tell you, it's never the time to have cuts in those areas. Those are investments in a better, healthier tomorrow. And every investment we make in those areas pays off in future budgets.